Blindness. It's so prevalent, yet so treatable. Countless of eye diseases contribute to causing blindness. These diseases include wet age-related macular degeneration, diabetic retinopathy, and macular edema. One thing these diseases all have in common is a new treatment. Today I'll be introducing anti-VEGF, a revolutionary medication in ophthalmology. What is anti-VEGF? Let us first understand what vascular endothelial growth factors, or VEGF, are. VEGF are signaling proteins located in endothelial cells, which are cells that line the blood vessels. The proteins bind to their receptors on the endothelial cell membrane called VEGFR1 and VEGFR2. Once binded, signals are sent to the cell to program for new blood vessel growth. Anti-VEGF is an injection that inhibits VEGF proteins. It's administered through the sclera into the vitreous humor. Anti-VEGF uses aptamers, or short DNA/RNA strands. Similar to antibodies, they only bind to their target proteins, in this case, VEGF. By binding to the VEGF, the aptamers prevent the VEGF from binding to their own receptors. This inhibits VEGF from stimulating angiogenesis, which is the growth of new blood vessels. This is helpful as abnormal blood vessel growth can lead to the rupturing of existing or new blood vessels in the eye. Damaged blood vessels can leak fluid and blood, which swells up the retinal cells. Angiogenesis disrupts healthy functioning of the retinal cells in areas like photoreceptors. Fluid leakage, rupturing of the retina, and swelling all damage the retinal cells. As damage builds up, this ultimately culminates in vision loss. So, anti-VEGF is effective at managing ocular pathologies rooted in angiogenesis. Such pathologies include wet AMD, diabetic retinopathy, and myopic CV, as angiogenesis most commonly occurs in the eye in the choroid, retina, and the cornea. Wet age-related macular degeneration is a progressive retinal disease which damages the macula, a part of the retina. It's characterized by a hemorrhage, or blood vessel leakage, under the retina. The hemorrhage scars the macula, causing vision loss. Next, anti-VEGF also treats diabetic retinopathy, another retinal disease. It's rooted in diabetes mellitus, or commonly known as diabetes. But how does diabetes affect vision? Well, this starts in the stomach where glucose is first produced. The glucose then enters the bloodstream. Glucose in the blood is known as blood glucose, necessary for nutrients and bodily functions. However, diabetes occurs when there is too much blood glucose. Over time, excessive blood glucose blocks off the retinal blood vessels, causing abnormal blood vessel growth. This can lead to hemorrhages and hard exudates, which cause vision loss. Lastly, anti-VEGF treats myopic CV. Choroidal stands for choroid, which is part of the eye that contains blood vessels. Myopia, commonly known as nearsightedness, elongates the eyeball. As myopia worsens, the irregular shape of the eyeball puts stress on the retina, causing abnormal blood vessel growth and leading to symptoms like cracking of the retina and fluid leakage, which ultimately cause vision loss again. In conclusion, anti-VEGF has many real-life applications, and it's helpful for treating pathologies which occur commonly throughout our lives. By recognizing this, we can foster a society more aware of eye diseases and how recent technology has developed to treat them.